risk travelers.
The New York City doctor who tested positive is in stable condition as disease detectives track his movements through the city.
And in New Jersey, a healthcare worker who spiked a fever after traveling from Sierra Leone has been cleared of Ebola but remains in isolation.
CBS 2's Ilana Gold is live at University Hospital in Newark with more. Ilana.
Andrea and Diane, just this morning we got the preliminary test results for the nurse here at University Hospital, and they came back as negative for Ebola. But the entrance is still blocked off and police aren't letting anyone inside because the patient is still in quarantine and doctors are watching her closely. The test results are in from University Hospital, and the nurse in mandatory quarantine for possible Ebola doesn't have it.
After the CDC alerted the New Jersey Department of Health, the New Jersey Department of Health has made the determination that a legal quarantine order should be issued.
The state wasn't taking any chances when she landed at Newark Airport yesterday. She was put in isolation right after telling screeners she worked with Ebola patients in Sierra Leone. At the time, she didn't have symptoms, but got a fever just hours later.
We are no longer relying on CDC standards. There are now New York, New Jersey standards.
Even though she tested negative, she'll have to stay in mandatory quarantine for 3 weeks. It's the new rule for people in New York and New Jersey who have had contact with Ebola patients. It's much stricter than CDC guidelines that lets those in question get treatment at their discretion.
We have to do more. It's too serious a situation to leave it to the honor system of compliance.
The rules come after a scare this week when New York City doctor Craig Spencer tested positive for the deadly virus. He flew back from West Africa October 17th, and his tracks are keeping hazmat crews very busy, especially at Gutter Bowling Alley in Williamsburg.
Every single hole of every single bowling ball, every single belt, every conveyor, every single pin set, everything is going to be steam cleaned, disinfected.
Crews are scrubbing every inch of this place. Spencer was here just a day before showing symptoms. He also went to a restaurant, took the subway, and ran on the High Line.
Just on the side of caution, we're going to go in and do a full decontamination top to bottom. All 10,000 square feet will be decontaminated. Not a spot will be missed.
They're also disinfecting his Hamilton Heights apartment, and his neighbors can't believe it.
I'm more concerned about him than I am for myself.
Dr. Spencer is currently at Bellevue Hospital in Manhattan, listed as stable, and back out here live at University Hospital, where preliminary results show the nurse tested negative for Ebola, but doctors still need to figure out if she needs more testing. Reporting live in Newark, Ilana Gold, CBS 2 News.